Greetings. My name is Jennifer Kelly, and I currently serve as the Federal Advocacy Coordinator for the Georgia Psychological Association with the American Psychological Association. And I also am the current president of the great association, the American Psychological Association. I would like to provide you with an advocacy update. In December of last year, the Advocacy Coordinating Committee presented to the Board of Directors the proposed priorities, advocacy priorities for the association, and they were approved by the board, and these are the advocacy priorities for 2021. So the strategic priorities are rooted in equity, diversity, and inclusion. In keeping with these strategic priorities, the APA's advocacy priorities encompass the guiding principles of non-discrimination, health equity for underserved and vulnerable populations, and health promotion across the lifespan and settings. Keeping the guiding principles at the forefront of advocacy for psychology ensures the greatest impact on the many challenges facing society. So let's start off by talking about the priorities that are unique to APA. The first is access to health services, including mental and behavioral health services. And in this, we want to ensure access for evidence-based health and behavioral health services within public and private healthcare delivery systems, expand the role of psychologists on interprofessional integrated teams. Next is funding for basic and applied psychological research. In this, we would advocate for increased funding for basic, clinical, and applied psychological research within key agencies, foundations, and funding sources such as the National Institutes for Health and the National Science Foundation, the VA, Department of Defense. Also, we would like to expand opportunities for application in public and private sectors. The next is our general applied psychology promotion. And in this, we would educate APA membership and advocate across key private sector stakeholders regarding the various contributions of psychology and the roles of psychologists in areas such as human performance, motivation, leadership and personnel assessment, conflict resolution, and civic engagement. Next is psychology education and training financing. And in that, we will improve access to graduate study for psychology, including student financial aid programs, loan repayment, and loan forgiveness program. Psychology workforce development. And in that, a goal is to improve training and leadership skills of the next generation of culturally competent, diverse psychologists, engage students, and secure federal funding for psychology workforce training programs, including accredited internships and postdoctoral fellowships that expand interprofessional training opportunities working with underserved populations. Also included in this is the reimbursement and scope of practice. And in that, the goal is to ensure equitable reimbursement for the full range of psychologist services, including psychotherapy, health and behavior, testing, and telehealth services. We would like to promote psychologists in federal health programs, such as ensuring psychologists provide Medicare services to the full scope of our licensure and supporting VA recruitment and retention of psychologists. The next group of priorities are the priorities where APA can make a significant contribution. And then these include the application of psychological science to pre-K, K-12, and higher education. The second is criminal justice, where we use psychological research to advance criminal justice reform, police community relations, and to address the disparate impact of mass incarceration on minority and low-income communities. Next is the future of work, health equity for underserved and vulnerable populations. We would like to promote health equity for diverse populations by reducing disparities in health attributed to race, ethnicity, sexual and gender identity and orientation, geography, disability, age, SES, and poverty, and underserved and vulnerable populations, including tribal communities, children, immigrants, veterans, and individuals living with HIV and AIDS. Health promotion and prevention throughout the lifespan and settings. Also included is science infrastructure and regulatory environment, substance use disorders and opioid and other drug epidemics, and violence and suicide prevention. The next group are the priorities and collaboration with partner organizations. So they are organizations that we partner with, and these are also significant areas to address, but we just work with partner organizations with these. And these include climate change, where we educate the public and apply psychological research and science to combat climate change and address its impacts. Second, discrimination, combat discrimination in all forms and settings, including education, healthcare, and workplace. Next is immigration. And we would like to continue advocacy around federal immigration policies and inform policies related to humane treatment of immigrants and refugees. And last would be to protect and strengthen safety net programs. So we want to protect and strengthen the safety net programs such as Medicaid, child care, family leave, nutritional assistance, economic stability, and housing programs. So this is an update, and this is a list of the priorities that APA will be working on for 2021. If you have any questions or concerns, please feel free to contact me. It's jkelly@apa.org. Thank you, and have a good evening.